Hello and welcome to the Dr. Amaka Nnamani show, where we emphasize preparation over perfection. If this is your first time here, welcome. Be sure to subscribe and like and share with all the moms in your life that you think this will benefit. So let's get right into it. So your baby is 9 months old and you're wondering what are all the things that should happen at this age. So just like we've done in previous videos, I like to talk about the things really developmentally in major areas like gross motor, fine motor, speech, and then obviously your self-care, right? And then we'll talk a little bit about your doctor's visit and things that will likely happen at that visit. So congrats again, your baby is 9 months old. You've made it as far as a parent. Things should start beginning. Things should be generally a lot more stable, right? So in terms of gross motor, which is those big motor skills, at 9 months, usually by the end of the 9-month mark, a lot of babies are beginning to cruise. So what does cruising mean? Basically, that means that your baby is holding furniture and walking around it. So your baby is pulling up to stand and walking around furniture. Again, if your baby was born premature, which is basically before 37 weeks or 38 weeks of age, we usually want to correct for that. So you want to be sure that all these milestones are based on your baby being full term. Right? So if you haven't already, at the 6-month mark, usually around 5 months is when I start telling parents to baby proof the house. So that means outlets are covered. That means anything you don't want your baby in really should not be within reach. So medicines should be out of reach. Cleaning supplies, you want to look cabinets that have cleaning supplies in them because they can reach for it. You want to make sure that the doorknobs, you have the doorknob locks. You also want to make sure that most of your tables have rounded edges versus square, sharp edges. And if you do, a lot of times you can purchase some of those like end table covers that makes it nice and soft, right? So that's basically for your gross motor. Really, your child for sure should be sitting without support at the minimum, right? But a lot of babies will be doing more than that. In fact, some babies will start walking by 9 months. So I've seen quite a lot of babies who are walking by 9 months. Importantly though, just like we talked about in our 6-month video, not every baby will crawl. So crawling is actually not a milestone, right? A lot of babies go from sitting to walking, and that's okay. And if your baby is walking, they will usually walk, the toddler walk, right? Almost like the drunk man walk, and that is quite all right. Now, with terms of fine motor, your baby is beginning to fine tune their movements as well. So they're able to do like a pincer grasp, right? So like a Cheerio, they're able to pick that up. And this really helps them with getting ready to be independent and self-feeders, right? So your baby will also start waving bye-bye. So that's a fun kind of social milestone. It's a fine motor milestone, but that's also considered a social milestone. It's always exciting when some babies will do like the backward wave. So they'll like wave like this, or some babies will even do like the queen wave, right? So that's always exciting to see in terms of that, right? So you also, again, for that reason, want to make sure that your house is childproof so your baby does not get into things that you don't want them getting into, because now they can grasp things independently. Now, with social emotional, you can start playing games with your baby. So a lot of babies can play peekaboo, right? And they should be able to play it back, right? So it's like, peekaboo, I see you. And your baby laughs and does it right back with you. It is such a fun time in life. So be sure to enjoy this time. And then with regards to speech, at the 9-month mark, a lot of babies are probably saying mama, dada. Now, just like again in our 6-month video, we talked about how a lot of babies will likely say dada before mama, mostly because D is an easier consonant than M. But around 9 months, a lot of babies, now will start saying mama and dada. And some babies may have like 1 or 2 words besides that. So enjoy all of this, right? And very importantly, I cannot overemphasize this, is make sure that you're reading to your baby all sorts of things. Like, I mean, obviously appropriate books. It doesn't have to be board books, but preferably board books, picture books, and really interact with your baby throughout the day, even when they're not reading to them. Now, with regards to sleep, most 9-month-olds will be sleeping 8-hour stretches at nighttime. So as a mom, you're probably beginning to feel a lot more rested because you're getting more sleep. Now, if you're a mom that is breastfeeding, you can continue to breastfeed, right? We always say the AAP really recommends breastfeeding at least for 2 years and longer, as desired by mom and baby. So because your baby is eating solids now, right? Remembering that with regards to feeding in the first year of your child's life, most of their calories are coming from either breast milk or formula, and that food is a supplement, right? So you want to continue to breastfeed if you are. I still recommend maybe waking up at least once at nighttime to do a dream feed or to pump so that you maintain your breast milk supply. Because again, around those times when moms will say, oh, my milk supply is tanking, but what's really happening is that you're not getting stimulated enough, so your body is down regulating. So you want to make sure that, I usually say try not to go more than 4 or 5 hours without being stimulated either by your baby or by a breast pump. And then when your baby is beginning to eat solids, you also want to introduce sips of water. Not a whole lot, just sips. And with sips, you have your baby use a sippy cup. It's another fun milestone, or even a cup with a straw, right? And the earlier you're able to get your baby to stop using the bottle, the better. So for a lot of babies who are breastfed, and if mom was able to be home throughout the time, some babies can just go straight from nursing to using a cup, and that's all right. Now, with regards to your doctor's visits, at the 9-month visit, I usually call it the happy visit. So if you've been really good with making all of your doctor's appointments and getting your shots and your baby's vaccines to keep them healthy, at the 9-month visit, most babies will not need a vaccine. However, they will need a hemoglobin and lead level, especially if you're in the United States, right? So it's a screening hemoglobin level, which lets us know if your baby is anemic or not, right? And usually levels above 11 is what we want to see, and if it's below, follow your doctor's directions. But high sources of iron usually are, your green leafy vegetables and your red meats, right? So you can really make that soft for your baby and try to include it at least 1 or 2 meals every day. And then the lead is a screening level. It's a screening, which is usually just a prick, right? But if your child's lead level comes out elevated, then there are, depending on your states, there are different protocols. And then it will usually be like a real blood draw, like a venous draw versus just a prick. We usually want those lead levels low or undetectable, because we know that lead also increases the risk for anemia, but also elevated levels of lead have been found to be negatively related to a child's IQ, right? So we're very, very proactive with making sure that those levels are normal, right? And then importantly, as always, mom, be sure to take care of yourself. Continue to do those things that bring you joy. If you're back at work, hopefully things are beginning to stabilize for you, and you're getting the help that you need and accepting the help that when it's offered to you, and continuing to do all the things that make you who you are, right? Joining a support group if that's helpful, or hanging out with your girlfriends like you did before the baby was around, with or without your baby. So if you have any questions about this, be sure to put them in the link in the comment section. I really want to hear from you. And if you're watching this just hit the subscribe button, okay? So you know, and the notifications bell so you know when we have a new video up. Be sure to like and spread to moms in your world. It really helps us spread the word, and if this has been helpful to you at all, we want to make sure that other moms are hearing evidence-based information. Until the next time, remember, preparation over perfection always. Toodles.